Hello, and today we're going to be discussing ovarian cysts. Now I'm going to separate ovarian cysts from PCOS because PCOS is a little bit more complex. It's a metabolic and endocrine disorder, so it's going to be a separate tag. And for here and now I'm going to be covering other types of ovarian cysts. Now, ovarian cysts are something that many women experience, and whilst they're often harmless, they can sometimes cause pain, leading to other complications. If you've been diagnosed with an ovarian cyst or concerned about them, then I hope this gives you a little bit of a better understanding of what's happening in your body and some potential treatment options, both conventional and natural. So what are ovarian cysts? Well, it's a fluid-filled sac that forms either in or on the surface of your ovary. And in most cases, these cysts are benign, so they don't require treatment. But in some instances, they can grow large and cause pain or even rupture. Cysts can sometimes be associated with PCOS, but it is not necessary to have an ovarian cyst to have PCOS, and hence why I'm leaving it as a separate entity. Now, one of the concerns with ovarian cysts is that if they grow too large, they can cause the ovary to twist, a condition known as torsion, or it could rupture, leading to severe pain and internal bleeding. Now, in some cases, further investigation will be needed to determine whether or not a cyst is benign or if it's malignant. So if it's not a dangerous cancer, or if it is a spreading cancer, malignant cancer. Particularly in postmenopausal women where cysts always warrant closer examination. Now, many ovarian cysts are asymptomatic, but when symptoms do occur, they can include pelvic pain, which can be dull or sharp, that is an ache that comes or goes, a feeling of pressure or fullness in the lower abdomen. You could have menstrual irregularities, and there can be pain during intercourse. There can be urinary frequency or tenesmus. They need the urge to go, but feeling that it's incomplete and you haven't finished. And in some more severe cases, there can be nausea, vomiting, or fainting if the cyst ruptures or causes the torsion. Now, there's several factors that can increase your risk to developing ovarian cysts, and they include infertility treatments such as Clomid, which can overstimulate your ovaries, the use of Tamoxifen, which is a drug commonly given for breast cancer treatment, a history of tubal ligation or endometriosis, hypothyroidism or pelvic infections, and smoking. And there's different types of ovarian cysts with different and unique characteristics. So bear with me. Follicular cysts. These occur whenever there's a mature egg which doesn't release during ovulation, leading to the follicle growing inside the cyst and into the cyst. Now, they're usually harmless and they disappear of their own. There's the corpus luteal cysts. These form after the egg is released, but fluid accumulates inside the follicle, leading to delayed and irregular periods. There's haemorrhagic cysts. These contain blood that can cause significant abdominal pain. Endometriomas. These are related to endometriosis and contain old dark blood that can be painful and may rupture. Dermoid cysts. These are benign but contain hair, teeth, or bone because they arise from a germ cell within the body. There's neoplastic cysts. These are tumours, growths, and can be either benign or malignant. Cystadenomas, which form on the surface of the ovary and are often large and mucousy. There are hormone-producing cysts, which interfere with fertility and menstrual cycles. Now, if you're experiencing symptoms or your doctor finds a cyst during an examination, then several diagnostic tools can be used. First and foremost is the CA125 blood test, which may be performed to rule out ovarian cancer. Though this test is not specific, it can be elevated for other reasons, such as endometriosis or pregnancy, but it's a helpful tool to gauge whether or not we need to investigate further. Ultrasound is common to visualize the cysts. And then laparoscopies, urinalysis, or physical examinations help rule out conditions such as PID or UTIs or kidney stones. Now, most ovarian cysts don't require treatment and will resolve on their own. However, if the cyst continues to grow, it's painful and can occur in postmenopausal women. So a treatment may be necessary, and pharmaceutically you will be given hormonal contraceptives to prevent ovulation or reduce the likelihood of developing new cysts. And then surgery may be recommended if the cyst is large, causes symptoms, or if there are concerns about cancer. On a herbal medicine naturopathic approach then, we want to support you as best we can in managing the ovarian cysts, especially for recurrent functional cysts. So the goal of herbal treatment is to improve pelvic circulation, hormone balance, and reduce inflammation. The pelvic circulatory stimulants are herbs such as yarrow, lady's mental, dong quai, wormwood, and ginger. Anti-inflammatory herbs may include yarrow, black cohosh, turmeric, lady's mental. The lymphatic herbs would be herbs such as calendula, phytolacca, thuya to support the immune system and help clear the lymphatic debris. Hormonal modulators such as Vitex, black cohosh can help regulate FSH, LH and estrogen, supporting hormone clearance and proper ovulation. And then finally, the steroidal saponin-rich herbs like Dioscorea villosa and Sisyphus are useful at ensuring proper ovulation and may even help regress functional cysts. Moving on to the diet, a balanced anti-inflammatory diet is incredibly important for ovarian health. So we want to have flaxseed, 1 to 2 tablespoons a day, freshly crushed to help balance your hormones. A variety of colourful fruits and veg, focusing on anti-inflammatory foods like berries, leafy greens, olive oil and fatty fish. Avoid processed sugars, refined carbohydrates and maintain stable blood sugar levels. Stay hydrated, drink your water and engage in gentle exercise to help improve pelvic circulation. Stress management is also pretty fundamental, so practices such as Tai Chi, meditation, deep breathing can help regulate the HPA axis. Now, if you are experiencing severe pain, sudden bloating or symptoms like nausea, vomiting or fainting, it's important that you seek urgent medical help. These can be signs of cyst rupture and ovarian torsion, both of which need immediate attention. Now, in most cases, ovarian cysts don't require treatment, and whether you're managing this on your own or with conventional medicine, it's important to stay informed and to work with your healthcare provider. But if you do want to go down the alternative health provisions and actually look at how to support your body detox naturally and get rid of those cysts, then you have some of the herbs here and on the hands sheet after. Now, if you want to contact me, you can do so through the wildsage@proton.me. That's an encrypted email and only I have access to it. Or you can get in contact with us through the website www.thewildsage.co.uk. Cheers.